Yeah, I know. Okay. Well, welcome to Grand Rounds, you guys. Today we have a really great case. Now, I kind of prefaced this last week with type 1 diabetes for a kid. This is not for the faint of heart, okay? So this is kind of like advanced Grand Rounds for this one, okay? So this is Mentoring Functional Medicine Grand Rounds. I'm Dr. Garrett. Today we got a really interesting case, okay? This again is one of our miracle patients. And this is a 8-year-old boy that had type 1 diabetes, and it was a little bit out of control, right? Because he's a boy. Men are the worst patients. 20-year-old boys are the absolute worst people in the world. And then 8-year-old boys are the worst for adhering to any kind of treatment. So the only time we see that kind is usually with Crohn's and gut stuff because it really affects them. But outside of that, this is a rough kind of case to come in for you because they're non-compliant, right? And so you're trying to reverse this autoimmune condition and make sure their blood sugars don't go too low or too high with a kid that's super active and not compliant and also is more likely to sneak food and ghosty, right? So, all right. So just so you know, it's not a starter place you want to be. But once you get several cases under your belt and you're just like, okay, you're feeling confident, you know what you're doing, then take on a type 1. Now, this 8-year-old boy, he had 2 years of type 1 diabetes. Typically, type 1s you're going to see as children. I want to say it's mostly boys for some reason. I don't think we've ever had a type 1 girl come through our office in 20 years, even a woman at all. So you should expect this with young boys. Typically, the pattern is always cesarean section. They don't get inoculated with their good bacteria. They don't go to breast, or they sterilize the breast. They got Pitocin injections for the delivery, so they don't make their own oxytocin, so they don't have milk let down. So then the baby doesn't nurse or latch, and of course. And then there's often disconnection between, you don't have that love hormone, you have that bonding that's taking place when they breastfeed. So now you're doing a bottle. So sometimes there's some dysmorphia there, or what's called a disassociation or postpartum depression now. And then they get ear infections, and then they get antibiotics. And then that destroys their microbiome inside, and then that leads to autoimmune conditions. So then they get usually a little bit of allergies and maybe eczema in the beginning. And then eventually, by the time they're like maybe 10 to 20, we typically see that's when they're going to get either Crohn's or ulcerative colitis or type 1 diabetes. So this is just autoimmune. It's the same. We'll kind of go over that too. Like, our approach is always the same for this. But we just have to be careful of hypoglycemia. So initially, he presented with polyuria, polydipsia, so he's thirsty and peeing all the time. Weight loss, and so again, failure to thrive is what you're going to kind of see on the growth charts. Chronic fatigue and marked hyperglycemic episodes with them. Now, when they came in, they were already seeing a pediatric endocrinologist. They already have their insulin injections, and they were moving to the possibility of a pump because he's non-compliant. So she actually, I think, was one of my students when I was a professor for anatomy and physiology. And so she called me up and was like, hey, can we fix this? And I was like, I'm pretty sure, but I've never done that before. But it's just autoimmune. Autoimmune is pretty much the same pathophysiology. It's the same lifestyle medicine process to reverse it, whether it's MS or Crohn's or eczema or migraines, not migraines, but lupus, Sjogren's. Should be the same exact process, right? So I was like, yeah, I'll bring them in and let's see. And so it's nice they have a good history. The physicians are very tightly regulating as much as they can the blood sugars and the insulin dosing, and then same thing with the parental. So this was a married couple. So that's a lot easier. Our second one that we'll present at some time for type 1, of course, it's divorced family and then they're dating other people. And so then you end up having 4 to 5 other people involved in this process, and not everybody really cares about reversing it for a kid and thinks it's even a possibility, and it's really hard to make these changes. So that becomes a huge extra complication that we have to kind of work through, where we're talking to all the parties involved. So at least they're not sabotaging, if not being very supportive, right? So with this one, it's easier because mom and dad are on board. They both knew me. They both had taken classes from me in college. So they were like, okay, how do we do this? And so type 1 is characterized by, of course, T cell dysregulation. So suppressing the immune system, sugar, chemicals, and stress. And then when T cells and B cells are suppressed through that, then they can make mistakes, and those mistakes are called molecular mimics or doppelganger mistakes. And the first one is typically pathogens mimic food. So the better they can mimic what they see in your body, which is food or tissue, the longer they can stay in the body and cause problems. So Klebsiella pneumonia is one of the big bacterial mimics for things like gliadin and gluten. And then, of course, that's all we feed kids is a bunch of bread. So very quickly, that constant suppression leads to now every time they eat gluten or gliadin, bread, wheat, that breaks down the gluten gliadin, and then they have this reaction. And then that's just inflammatory reaction, all right? So maybe IBS or, rashes, that kind of thing. But if it makes a secondary molecular mimic, and now it looks at a tissue antigen, or the epitope of like a beta cell in the pancreas and the islets and Langerhans, that sequence of antigen looks very similar to gliadin, which looks very similar to Klebsiella pneumonia. Well, if your immune system is chronically suppressed, now it thinks that that food is also that tissue, which is also the pathogen. And so it's just this double doppelganger mistake or double molecular mimic mistake. Now it makes a T memory cell and a B memory cell, and so every time they eat bread, the infection is long gone, but now every time they eat bread, it breaks down the gliadin, the body goes, oh my God, we got attacked, let's create a bunch of inflammatory histamines. So then they just have these inflammatory behavioral problems, especially with kids. Then it attacks the beta cells of the pancreas. So it's not a disease necessarily. It's, of course, that's what's going to happen, right? So the nice thing is that once you know this process and the pathophysiology of this, and it's been well established in research for the last 25 years, and we literally know, if you've taken the mentoring functional medicine course with the research for T cell dysregulation, molecular mimicry, we literally know which pathogens mimic which foods, which mimic which tissues. So the pathogenesis of this is pretty straightforward for the last 25 years, right? Now, our goal is to fix, not manage autoimmune. Like, we don't want to, again, biohack and all that bullshit where, we're messing with T1 versus T2 ratios, but they're different in different parts of the body. So you mess with one, it's just like a drug where you're affecting the other pathways. Well, T17 and Treg cells, and I'm going to do this and that and that. In fact, no, just stop causing the problems, right? Don't worry about all that stuff. We don't want to manage autoimmune. You always want to reverse autoimmune. And it is insanely easy to reverse autoimmune, right? So these beta cells that make insulin are being attacked through this process. So then, of course, you don't make insulin very much. Now, all these people are still making insulin, even type 1. So again, the body's regenerating through stem cells to repair that islets of Langerhans and the beta cells. But you also have the immune system attacking, and so based on how much insulin they're actually producing is going to be based on how much damage is taking place and how much recovery is taking place. So the body's constantly trying to restore those beta cells. So when they tell you the pancreas is dead, that's not true, right? It is just being overwhelmed. So once we stop causing that, then the stem cells keep producing more beta cells, just like they're supposed to. Your whole body regenerates in 7 to 10 years. Most of it's daily. So you're constantly trying to rebuild that tissue all the time. That's why Crohn's and ulcerative colitis are some of my favorites, because man, they turn over so fast, like 2 weeks, and you should be symptom free, right? So with beta cells, we should see that quick turnover too. Now, I'm pretty sure that's all covered in our reversing type 1 featured topics within the Mentoring Functional Medicine program. So if you want more information, we have that. Now, for this case, the child and parents managed the glucose monitoring. I believe they were doing finger sticks before the glucose monitors were available back then, the continuous ones. Carbohydrate counting was a big deal, which again, the kids don't give a crap about that, and it's frustrating. And then, of course, the insulin administration, which the kids don't like. And then school day management is a mess, because now, again, you got a third party trying to manage these kids for which they have very limited knowledge on, and the kid's not compliant. So it becomes a huge extra frustration there. Exercise adjustments, these 8-year-old boys typically, they're super active, right? So they're going for jumping on trampoline, trying to play baseball, trying to eat a bunch of crap and snacks and all that, and a bunch of sugar. And everybody's trying to manage that chaos in the process. So sports, sleep, travel, all that kind of stuff becomes big issues. It really disrupts the whole entire family routine. Like the whole family is really burdened as a probably word you don't want to tell them, but it's a huge burden, right? And I don't want to be a jerk here, but sometimes you have girls that are interested, and you're like, oh, we should go out, and they're just like, yeah, my kid has diabetes, and you're like, that's a lot. Like, I don't know if I'm ready for that. That's someone else who's going to be a better fit for you, because oh my goodness, a non-compliant, like, it's hard enough raising your own kids. I have 4 kids. Like, that's already exhausting. Imagine them non-compliant and you could die at any day. So, I don't know. I don't want to be a jerk, but that's the real. And then, so mom is the most aggressive. Dad's a part of it, which is great. Like, again, the whole family is pretty involved in this one, but again, it's the whole thing. So if we could stop causing this autoimmune, stop attacking the beta cells, his beta cells keep regenerating through stem cells, then he can produce enough insulin, and then the whole family gets their life back. So medication and doses, basically, again, short-acting, long-acting insulin is your standard treatment for that. And they have their own little complications of that too. And of course, you're also making your own insulin through the beta cells that are still surviving. So you're constantly trying to figure out this rhythm of how to dose for this. Now, with the continuous glucose monitoring, it's so much easier, just so you know. And they were doing the insulin ones to basically correct the carbohydrate ratio and correct the insulin production. And so basically you are not really, it's really like reactive. It feels like reactive medicine with this and dosing. And eventually they were wanting maybe an insulin pump, so at least that takes a little bit of burden off everybody and reduces the non-compliance. The 2026 ADA standards, just so you know, recommend offering a continuous glucose monitor now and automated insulin delivery for children, especially that are non-compliant or the caregivers are not very good at kind of monitoring the whole situation too. So basically, a continuous glucose monitor as of 2026 and insulin pump is like the gold standard for kids with this. Now, typical management is just lifelong insulin replacement as the body's attacking it, never really addressing why. Prevention of hypoglycemia is the most critical part of this, and they can always take more insulin if they're hyper. But if they go too low, then the insulin could kill them. So we don't want to really mess around and be half-assed with these kind of cases. So prevention of diabetic ketoacidosis. Everybody wants to do ketones for like carnivore diet and what's the other one? Shoot, I haven't had one in a while. I don't know why it's skipping my brain, but they're all wanting ketones because your brain runs off ketones and sugar, but then it basically you're burning more sugar and a little bit more stable sometimes. But now that's great for that type of diet with the ketone regulation is really great for seizures for children. Again, not a long-term fix, and we've seen kind of like way better solution of just doing whole food, low glycemic, nutrient dense than we really have with the ketone. Is it paleo? I want to say, I feel like it's not. It's, I think it's one more thing, but maybe paleo diet is the one that I'm thinking of for them. So everybody wants a bunch of ketones except for the people making a bunch of ketones, which is the diabetics. So that diabetic ketoacidosis can shut their brain down, put them in a coma pretty quick, and they can die because of that. So the whole thing is just to surveil constantly risk of hypoglycemia. And for most children and adolescents, basically the ADA is 7. Again, we talk about that when we talk about reversing type 2 diabetes. So they used to be 7.5, then 7, then 6.5, then back to 7, then back to 6.5, then 5.7, and then now they went up down to 5.4. But just know they keep changing the numbers because 1 and 2 people are either pre-diabetic or diabetic type 2 in America. So for type 1 though, that glycolated hemoglobin, A1C, around 7 is great, 6.5 is better. But that's our 3-month kind of average of, okay, how compliant and well are we doing with all the complicated factors involved with this? So for this kid, that's your standard type of expectation. So we did our little functional medicine thing, right? So we did our protocol, which is, again, create a list of everything falling apart. And really, 8-year-old boys, they don't have a huge list like 30-year-old women. But I wouldn't say it was probably behavioral stuff, sleep stuff, mood stuff, kind of things you would expect. So he had just a little handful of chronic issues. And so we did the food sensitivity because our goal is to identify what is being attacked by food that's mistaken as a pathogen that then would relate to the beta cells. So we don't know which ones are, but we know they're in there somewhere. So out of that list of 184 foods that we typically test for IgG or delayed sensitivities, there was probably for him maybe like 60 and only a few that were high. Now, just know, we always tell everybody, no wheat, no dairy, no added sugar from the beginning, right? So till we get this test back, we always say those because gliadin and casein, whey, lactase are the most common molecular mimics when it comes to autoimmune conditions. So it's rare that someone doesn't have a reaction to that. And even if they do, we don't test all the gliadins and stuff. And we don't test lactose. And so still, it's most likely, right? And in 2026, in July, I put this on the Dr. G Show Facebook, that they did a study of Gen Zs, and they found that 100% of those kids tested had delayed food sensitivities that were significant. And then 80% of the foods of those tested for Gen Z had dairy allergens. 50% of those kids tested had tested positive for wheat and gluten allergens. And so again, type 1, any of these autoimmune, always assume it's American dairy, American wheat, American gluten. So we're always gluten-free, dairy-free from the start. And of course, added sugar, like half their diet by 15 is just sugar. So sugar suppresses the immune system. We're trying to reverse that. So again, always process over perfection, especially as parents. We're always basically teaching the parents to implement for the children, but you only have so much control with that. So it's always just do the best you can, process over perfection. let alone giving yourself grace and space, right? But giving the kids some grace and space. This is a long-term solution we want. So again, we're not worried about fluctuations. We're worried about long-term sustainable fixes with this. Getting that family their life back. So then we, of course, go through, and mostly we don't really typically see the kids when they're young because they don't care what we talk about. We do have some kids that, man, they pay attention to the stuff we talk about. And if you do your talks like I do, the way we train through the mentoring functional medicine program, it's always scare the hell out of them, overwhelm them with so much logic and research and application examples that they're not swayed. And because it's very hard when you go to like one practitioner and they're like, oh, dairy's the devil. And then you go to another one, they're like, dairy you have to have. And then you see a podcast, they're like, well, some dairy, and then nobody knows what the hell to do. But if you give them an overwhelming explanation of why, they tend to be more adherent to your protocol. So everybody does their gimmicks because nobody wants to say the same stuff. We say the same stuff. Stop causing your problems. It's most likely what you're eating, drinking, breathing, rubbing on your skin, how you stress. All things you get to control. So, and don't think this is genetic. It's not a genetic thing. You might have a predisposition for a gene issue for getting type 1, but no, it's just autoimmune. Treat it always as autoimmune. And a lot of people don't know your genes are epigenetic for most of the part, and they just kind of turn off and on. So again, if you live a lifestyle that's incompatible with life and longevity, you're going to turn on genes that are going to make you worse, and you're going to turn off genes that are preventing you from getting better. Because the body's conservation of energy, it's also survival of the fittest, and the body basically is like, if you can't pull your shit together and live a healthy life, you should not be breeding. You should wither away and die. We literally have oncogenes built into our DNA that are like the doomsday scenario for like every James Bond movie where they're like, I just push this one button and we're gonna just blow up this whole thing that I created. Well, the body does that too. The body's like, man, I built this amazing thing. If you can't get your shit together, I'm gonna kill you. So that's why we see thyroid problems, autoimmune problems, hormonal problems. Because if you cannot create a normal, happy life, then what's the point? So our goal is always address this as autoimmune. Don't worry about genetics. Fix the genetics with the lifestyle changes. So most of that stuff will turn on and off based on dietary changes. So we go through the whole change with him, and then of course we're meeting. This one we're meeting with just the family. He has, I think, a couple sisters, but again, the parents are relaying this stuff to them, and it's pretty easy with them. But when you get mixed families and divorce and co-parenting, oh my God, it's a thing. So we go through that whole protocol with them. They implement it for him, and again, the goal is to regulate and document the changes with blood sugar to prevent any hypoglycemia. So what we want to expect is, if we're right and we can reverse type 2 or type 1 autoimmune diabetes, then the minute we stop triggering these secondary molecular mimic mistakes, then it stops attacking the beta cells in the islets and Langerhans, and then the stem cells produce more beta cells like they're supposed to, and then you produce more insulin, and then you have a systematic longer normals, less highs and lows, and you have less and less insulin and greater stability. But that has to be tightly regulated with them, okay? And expect that kid's probably gonna do some ghost eating and that kind of stuff, but you should just see things progressively get dramatically better and better with this. And then, just like our first type 1 that we reversed, which was a 25-year-old guy, he'll be one of our case studies, he was buying insulin off a Craigslist because he couldn't get enough insulin to get his blood sugar down. And he got to the point where he was just feeling horrible all the time. And I was like, yeah, you probably don't need the insulin. You need to keep checking your blood sugar before you keep giving yourself the regular injections. And he figured out very quickly his pancreas was making it, and he stopped needing to buy extra, and then he stopped needing to do the long term, and then he stopped needing to do short term, and then he's diabetes free, right? So that's what we want to see with this. And so this one, it took about 6 months of lifestyle changes, and that's pretty good with the non-compliant. And improved time and range is the big goal for blood sugar. And again, we want to see a better in-range postprandial 2-hour test. Reduce glucose variability. So again, more of this and less of like that. Few hypoglycemic events, which is again the critical point that we want to see. And improve energy and focus. And oh my God, behavioral stuff is so much better with him. And then of course, reduce insulin under parental and medical supervision. So again, not you making these decisions. The mom's going to make it, and the dad's going to make it, and the kid's going to make it under the influence of the physician that's recommending these things, right? So then with our kind of takeaway from this is just knowing that with functional lifestyle medicine protocol, we can reverse type 1 diabetes because it's just T-cell dysregulation and secondary molecular mimicry. Now, one important thing about this, because again, you would think that people would just celebrate these kind of victories, right? Well, so they got to the point where they no longer needed insulin. They had well-documented normal blood sugars. Again, even with little cheats, he was staying within his 2-hour postprandial under, I think, 125, which is really good control for 2-hour postprandial. And at night, it was doing good. No is that the Samoji effect, I believe, where the body overcompensates. And so they had this great, just documented, we reversed it, right? So the kid's no longer on insulin. They go back to the pediatric endocrinologist, and they're like, yeah, he's totally off insulin. And that endocrinologist freaked out, even seeing the success. She told me, she was like, you would not believe what this doctor said. They were like, you have to give him carbohydrates like bread and candy because then you give him the insulin. Like you can't just not give him that and all this. You got to give him carbs and make his blood sugar spike so you can give him the insulin. And like, she's like, do you hear yourself? Like why would we cause hyperglycemia when the balance is normal without intervention? So obviously, the beta cells have recovered through stem cells, naturally produced. We stop attacking them, and then everything's normal. But I told her it's not a big deal. It's kind of expected. Like we see this all the time because they don't see anybody reverse, right? And you would think the gastroenterologists were, okay, so now this person doesn't have Crohn's anymore. They're like, we can't even do a colonoscopy because it's more risk than benefit since you have no symptoms and you're not on meds. Like, you would think that they would be like, hey, how can we do what you do for all our clients? But it never happens. But I gotta say, after probably the last 10 years maybe, I started finally, like, physicians would always refer their families. Families and friends, you're gonna get referrals. But I was always surprised they would never refer all their chronic patients. Like, we reversed this. We reversed it with you. Why wouldn't you? But it's their money, right? It's their practice. It's a trade organization, not how can we just do the best we can sometimes. Again, we're not shitting on other doctors. It's just even natural medicine doctors are like that too. So most people have never seen things reverse. They do not expect them to reverse. And they are just like, I don't know what to say. You need to get back on your meds. Like, that's it, right? So then they have that shock, right? So then they go to the Facebook, and she's part of this mom's group for years with, how do we help these kids? And like, well, my kid has this, and this helped with this kid. And all these parents trying to really coordinate and figure out solutions for a bunch of kids that are non-compliant with this. And you could die, right? I mean, lupus, Sjogren's, eczema, I mean, it's uncomfortable and it sucks. But type 1, they can die pretty fast if you mess this up. So then parents are all super concerned, of course. So she posted what she did and that her kid has been type 1 diabetes free for months. And she thought, oh my God, like this is going to be so well received. And it was not. She had to take her post down. She called me, I think on maybe the 6-month review or something. And she was like, people were pissed. They were like, oh, that might work for your kid, but they ain't going to work for my kid. And are you telling me I haven't tried everything? I'm like, holy crap. Like, why is there ego and pride involved in this, right? But you're an expert, everybody else is their expert, and then you only believe what you believe, and it's okay. It's okay. So just know it may not always be well received, which is the weirdest thing sometimes. And even if you prove it out and you reverse these people, a lot of times their specialists are not really going to refer people to you. Now, I got to say, in the last 10 years, though, for Crohn's and ulcerative colitis, we actually finally have the gastroenterologists that are referring their people that are just not working. Like nothing's working. The medications aren't working. They're still having constant flares, maxed out on meds. We've actually had a few of those that are like, yeah, my gastro said you're the guy. Like you've helped reverse some of their clients before, and whatever he said, whatever he says, do it. He said it works. And I'm like, well, why isn't this dude referring everybody to me, right? So I'm glad to see those like doctors where, in the traditional system of like, well, we're not fixing and we're run out of options, that they're actually referring for functional lifestyle medicine. So I'm very grateful about that. Like it's been a hard road of kind of proving out all these techniques and really making sure that you get the best clinical outcomes and do the least amount of harm. So, or risk, I guess if you'd say that. So with type 1, that risk is hypoglycemia. So I like the ADA's recommendation for 2026 of continuous glucose monitoring, not for the pump. So if you're gonna do this, make sure they have the continuous glucose monitor, make sure everybody's on board and they are chronically aware of the symptoms for low blood sugar and constantly vigilant about noticing those things. So, all right. Hope you guys enjoyed this. I don't know what our case next week is. I'm sure it's really good. But bye, you guys. Appreciate it.